Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Swathy Rohit with us. Swathy is the co founder of Health Basix, that's based out of Coimbatore. It's an organization that is seamlessly connecting children and families to affordable healthcare services. So, when we talk about affordability, I think there are multiple challenges in healthcare, and any startup who's actually trying to focus on any of the problems, be it availability, affordability, or accessibility, definitely it's trying to solve the big, huge problem of healthcare for all. So, let's find out from Swati more about their startup. Hi, Swati, welcome to MediCircle.
Hi, Smita. Thank you so much for having me today.
The pleasure is all ours, dear. And quickly tell us when you started, how you started, why you started.
We started actually exactly a year ago, incorporated, of course, early 2021, but the team came together and started in September 2021. We're exactly a year old, so excited because healthcare is always an exciting time, never been a better time to solve problems in healthcare. So what do we do at Health Basix, right? We're a platform that actually helps all parents with their number one goal, that is to see their children healthier and worry a lot less about them. So that's what we do. We actually go into schools. We help parents in three different ways, right? What's really on every parent's mind? I'm a parent of a 16-year-old myself. So what's top of mind, that question that comes to me, right? Today we have a lot of issues with children, right? We see across whether it's sickness, mental or physical health, right? I can show you statistics. We constantly think that don't break it unless it's don't fix unless it's broken in children. But really, I think when you go out there and ask a parent first thing and say, how is the health of your child? Do you focus on it? First question will be, oh, their children, when they fall sick, let's worry about it. Or their children, they should eat a lot of sugar, they should eat everything, and they should be how they are. But if we look around us today, right, in India specifically, we're like the diabetic capital of the world. We're also the hypertensive capital of the world. All of these are lifestyle diseases. And this is not, and I constantly tell people, it's not because of decisions we took today and yesterday, but it's decisions we took when we were children. So good habits start when we're kids. Focus has to start with our children, and that's where the whole story begins. So the top questions we're trying to do is, number one, ask parents are always wondering, they see a lot of behavioral issues today. Gadget addiction is huge, right? Can you believe 65%, there was a recent article that came out, 65% of the kids are addicted to gadgets in some form or other. And be it behavioral issues, the number of sick episodes. India is also the second most obese nation in the world, right? So parents have a lot of problems. So number one question, where do we start if we identify a problem? So number one, we show them, diagnose kids, as well as show them what the strengths of each child is, what are the weaknesses, how can we actually get children to a place of strength. Number two, as you said, access is everything, right? You might wonder, sure, there are hundreds of pediatricians, so what really is Health Basix doing to fix the whole problem of access, right? It's all great to diagnose, and middle of the night a parent wakes up. You constantly have this issue where somehow our children only fall sick at night, in the middle of the night. We're always trying to find out, oh my God, what could it possibly be, right? We're here 24 hours a day to answer all parents' questions. We have symptom checker. We also have access to online pediatricians 24 hours a day to help our parents to really figure out what it could possibly be, instead of Googling 100 results and getting worried at night. Also, we connect to offline specialists a lot of times, right? You realize that your child is not reading up to the rest of the class, right? They are falling behind. What do you do? Where do you go for help today, right? We're not talking even about specific learning difficulties, even if there's a learning gap, right? Say, even in sickness, you suddenly realize that they have a lot of abdominal issues. Pediatrician multiple visits is not solving it. Who's the best pediatric gastroenterologist in your neighborhood? neighborhood. Do you really know? So this is what we really do. We fix for access. And the last question is, we always believe that there has to be continuity of care, and not just diagnosing, not just, pointing them in a certain direction, but actually, growing with the child, keeping track of the child, knowing what antibiotics they've taken, storing their records, and being there for the parent 100% of the time, and, fixing the whole care continuum. That's what we do at Health Basics.
That's good to know. As you mentioned diabetes, I would like to share some facts. In India alone, there are 98,000 children that have been diagnosed with type 1 diabetes. Also, type 2 diabetes in children is gradually being reported across the country, though the prevalence is not as high as other Asian countries. That's a relief. But when we talk about pediatricians and accessibility to them, again, there is an issue because, again, when you have the problem, it's just not that, yes, the pediatrician may be available. Definitely, there has to be some support system where we can access. As you said, that generally children fall sick during midnights or when there is little availability. Also, when we talk to a doctor, they have limited time for the patients. That's one more thing, because again, there's huge burden of patients who are, and that one pediatrician is having and solving. Along with that, there are lifestyle issues, modifications required, and one very important fact that you said, that this has started right from the way we raise our children. We need to take care that whatever food we are giving them, what kind of habits they are having. Why there are so many children who are now getting type 2 diabetes? Earlier it was not like that. So there has definitely been exposed to more and more environmental factors and other things that needs to be considered. Swati, tell us one more thing, that when you started Health Basics, as might be finding, there are other startups also who are still connecting both the children and the families with quality and affordable care. So what is your USP, your mantra?
Right. Today, if you actually looked in the healthcare ecosystem, right, health tech ecosystem, there are lots of people focusing on babies and mother and, post pregnancy. And you'll see a lot of people again focused on diabetes management, hypertension management, cancer care. But if you really thought about the school going population, it's very few people who are actually specialists or even focused on this population, right? You'd be hard pressed to actually think of a name. I can challenge you right here saying, what, other than an edtech startup or something like that, can you think of a single healthcare thing that's, of course, there's always the practice where you can go and, look for doctors, but, how do you know one is better than the other, right? And
specific, especially for the adolescents, like I have a daughter who's 16-year-old. And if you tell me, just to tell some good healthcare startup only taking care of this age group, along with that mental healthcare issues which they might be having, peer pressures, that other thing, but they are other things also, other typical health issues that needs to be addressed. So yes, you're quite correct in that we need more and more help that is being required, especially for the parents who are looking for such kind of care for their children. So tell us how many lives you have touched so far, especially when you talk about children in your spectrum, as it has been 1 year.
We have 140,000 children who we have screened, as well as, been in touch with the parents, been able to in some way or form help the parent and the child. So when we say 140,000 kids, right? And what we also pride ourselves, when you ask to connect back to this, to the previous question, right? We're the only startup who focuses both on physical and mental health, right? It's not just physical, it's not just mental. We believe that it is primary basic care that needs to be addressed holistically for children, and that's what we do. And as I said, 140,000 children approximately in a year's time.
And that's great to know. So how has, like, as you are connecting with schools also, students, children and communities, so how is the basic idea, like you opt to connect through schools? What is the process?
So, if you notice, again, another problem with parents is even though they're not with us, right, and they spend a lot of time in school, we're constantly worrying about them, right? So, why do we go into schools? Two reasons, right? It's all great that we are helping parents and diagnosing, but if we don't help children make healthier decisions, right? If it only comes from the parent going on telling the child, do this, don't do that, smoking's bad, drugs are bad, is it really going to work? Or eat nutritious food all the time? Children need to start from kindergarten and pre-KG with better habits. So we go into school, we actually have a social emotional learning curriculum when it comes to mental health. We actually have a curriculum that talks to kids about nutrition, about viral infections, about diseases, and where to go for information, right? Today, just because you Google and the top two searches are not really what, give you accurate information. Children need to sift through the information and know what's right for them. We really believe that change has to come from children. That's why we're really excited to be in the schools, to have access to the kids, to be able to take, learning to them to make better decisions tomorrow, both health, mental and physical health.
So, what are the programs, especially you are running for these school, so that the counselors, the teachers, they can actually help the child, help the kid, making them aware about their health conditions, and if there is anything which is very specific and they need to connect with a doctor or a professional. So, how does it work?
So, what we do is we offer a couple of services. One is we put up physical clinics within school premises with a trained nurse in school premises, also connected to our command center of doctors. So, every time a child comes into our school clinic, a doctor comes on for a consultation and actually hears the child, makes a prognosis on the diagnosis for the child. And number two is we also do health assessments for the kids, because we believe that we need to have here in abroad, you have this annual, child checkup. But in India, that whole concept doesn't exist, right? We only go for antibiotics, we go when they're sick to the doctor. So we believe that it's really important that we have, good quality data for the child and the parent so that they make better quality decisions for themselves tomorrow. So we have assessments, the clinics. We also have counselors, mental health counselors, and emotional wellness counselors in school. We also have a special education, specific learning difficulty program where we not just diagnose, but we also have remedials for, so 4 different types of offerings for schools that we offer.
That's good, but just as you mentioned that there are many few schools who are actually running health checkup programs. I remember my school when I was in 6th, 7th, and 8th standards. There used to be health checkup programs, but nowadays I find that there's an infirmary in the school. But yes, these health checkup programs are not happening. While we talk about digitalization and commercialization of healthcare, we are becoming more aware. But I think we are not still working at the grassroots levels where we want our future to be safe, secure, and healthy. Definitely, we need to work from the grassroots level there, where the kids are spending the most of the time after home, which is the schools. And definitely, they need to be aware because at that time they are more active. And there are some things which only at the schools it is easy to find out. There are some behavioral issues which is very much common because when they are at their home, they are in their comfort zones. And when in their schools, they are out of these comfort zones. So I think it would really work if the schools actually take these programs on a very regular basis, so that more and more children can benefit from it.
Absolutely. Well, very well, like summarized, Smita. So, and schools have been extremely, forthcoming, and they really want to implement health programs because they are also facing a huge difficulty in dealing with behavioral
Yes.
level issues,
Yes.
health issues.
Yes.
So we really their emergency first response team. We are their healthcare team, to deal with whatever healthcare needs that a school might have.
Definitely. And according to research, Swati, 95% of our subconscious programming is developed as a child itself, which largely influences our entire life. So, as an entrepreneur, do you think these mental health programs should be taught in the schools? If yes, why?
Yeah, so social emotional learning is a very, very new concept for India, right? For example, if I went and spoke about it, very few people really understand what does a school counselor do? Why do you need it? What is social emotional learning? One, you really put that well. And a lot of the behaviors actually are formed, especially mentally, under the age of 7, right? So it's very important that we work from the pre-primary level itself. And at the end of the day, kids have to actually learn from very early on, and you have to be there on the field to believe the transformation we see within a year. And that's the best thing that we see, right? At the end of the day, there's nothing like healthcare that gives you a great sense of satisfaction in what you do, being able to help kids.
Charlie. And on the ending note, would you like to share some experiences that you had during your journey that you would like to share with fellow entrepreneurs here at Medicircle?
Right. I think there are so many problems to solve in healthcare, especially, right? My 2 bits is pick a vertical, dig deep, work from the bottom up, and never give up, because it's never easy solving such large problems. Because I believe that, unlike in other startups, right, you can't, fix it if you break it or anything like that. You really need to be totally committed. And healthcare is something we have to take very, very seriously, because health is everything. And so never give up. And your dream, and keep working at it. It's definitely not easy. So please get a good support system and a good peer network that will help you to, if you have any problems along the way.
Yes, that's really some cool and intelligent words from the experiences of Swathy Rohit. We definitely need to learn from our previous mistakes and keep on chasing our dreams until we have achieved them. Especially when we talk about something like children's health, this is really, it's not going to happen overnight. It's a reform. It would take time. But yes, we need to contribute. We need to think over it as we discuss. This is a really interesting topic that we took today, and I'm glad that I am speaking to you, Swati, because children health, especially the school-going population, is really little bit neglected. When we want our future to be really healthy, again, then only everything depends on that. So we definitely need to take care. I think schools should also be playing a pivotal role here with the help of startups. Like Health Basics, which can actually help you keep your children healthy. So thank you so much, Swati, for joining us today at Medicircle Healthcare Startup Series. We wish you and Health Basics all the best for its future endeavors.
Thank you so much, Smita, and for having us today.